Hi there, my name is David Coletto and I'm the CEO of Abacus Data. Welcome to In Focus. At the end of 2020, my firm conducted a national survey of 2,000 Canadians, asking them questions about the state of Canada's healthcare system and the role that self-care can play in sustaining it and improving it in the future. On February 3rd, I led a panel discussion with leading experts and policy leaders exploring how self-care is being used around the world and how it can be used in Canada to improve not only patients' health outcomes, but also improve the sustainability of Canada's healthcare system overall. Here's what we heard. One of our audience members asked, okay, so you have got the 7 pillars of self-care. What do we have to do as a country to move it forward? And Jerry, this is a nice lead into our next topic, which is, FHCP put out a call, a blueprint for a national healthcare strategy as a starting point to moving, bringing people together. And so in the survey, we asked Canadians if the federal government announced that it was going to develop a national healthcare strategy as it defines as giving Canadians better tools and support for taking care of their own health. Do you think this is a good idea or not? And I don't think it should be surprising to anybody at this stage, given how supportive Canadians have been all along, but we find almost 90% say that a national healthcare strategy would be a very good thing. We see a cross-national consensus and a cross-partisan one. So it's not a liberal, NDP, or conservative issue. It's something that again, unites Canadians. Lastly, we also tested some ideas that could be part of this strategy. Things like improving health literacy so Canadians can make better decisions about their health and improve their ability to care for themselves. 82% said they'd like to see that as part of that strategy. Very few said they don't. Removing the GST on non-prescription medications, thereby lowering their cost for consumers. Anytime we test a reduction in GST or tax on anything, we find broad support. But in this case, keep in mind that not only was healthcare number one, cost of living was number 2 as a top issue. And so there's always that sense that Canadians feel that life's expensive, and any way that we can make it more affordable will work. Allowing Canadians to claim non-prescription medications as part of their medical expense tax credit. Three out of 4 say that's a good idea. We start to see unsures increase a little bit. People need to be maybe get more information. Removing unnecessary barriers to switching medications for prescription to non-prescription or over-the-counter status. 60% like to see that happen. Sometimes there's a little friction on that issue, but we don't necessarily see much in this survey. And then lastly, changing regulations to ensure that companies that make non-prescription or over-the-counter medications and natural health products can more easily introduce those new products into Canada. We see also fairly strong support. So I guess, Jerry, I'll start with you. Where does a national healthcare strategy fit into these bigger policy goals when it comes to healthcare policy in Canada, both at the federal and provincial level?
Well, I think what we're hearing in the poll, and it's certainly, we're hearing it in the day-to-day news, that there's a good deal of anxiety among Canadians about the state of our healthcare system, its present challenges and its long-term challenges. And we're hearing a lot of alignment around the idea that self-care can play a big role in that. I think it's important to think about that as in some respects, we talked about how politically, demographically, regionally, it's a consensus. But in terms of giving it effect, top of the list, when we examined this issue and came up with the blueprint, we really think the first step here, there are some obvious foundational issues. Health literacy has to be at the heart of this. But what we really need is a national conversation and the opportunity to use parliamentary study of something of that nature to bring the various stakeholders together to talk about how can we give this effect. And I think we need to have that conversation. That said, there are evidence-based things we can do today that, just in the narrow area of consumer health products, the way they're regulated, et cetera, just providing more options itself can be a really important step forward for Canadians. When, just as an example, back in 2012, the government of Canada just took out a completely red tape 1 year delay that the switching process had to go through before you could make those medicines available. In the 5 years before that, we'd seen one product switch to over-the-counter status. In the 3 years afterwards, we saw 7 come over. So we know that there are barriers that we can address quickly, things like drug scheduling, so on and so forth. But I think as a political proposition, the idea here is that it's responding to a very deep anxiety that Canadians have and a desire to be part of the solution. It seems like an easy sell.
And Judy, from your and Christine as well, from a global perspective, is there any lessons that we as Canadians, policymakers, can take from what other jurisdictions are doing on this front?
Well, actually, in a way, Canada and FHCP is kind of one of the world leaders in what they're doing with self-care and where they are, because there are not many countries where self-care is actually embedded in policy. So again, it goes back to what we're saying before. We need to make it easy for policymakers and politicians to get on board with this. At the same time, enhancing health literacy and trying to educate consumers and give them the tools to be active self-managers of their health. So I think Canada, Australia, UK, US, the usual suspects are doing quite well, but no one really has done such a fabulous job that it's like, here's the shining beacon, we can all aspire to this. So Canada is doing really well, but it just shows how much more we've got to go.
Christine?
Yeah, I think Canada can really look at how to lower the barriers. I think this is for communities and for individuals. So both in terms of professionals, but also environmentally, can we build sport facilities? Can we make more green spaces where people can actually conduct self-care at home and locally? Because if we get people together and they get to know their neighbors, we see also a ripple effect to other areas. There will be less crime, people will have an increase in mental health. It's not a standalone issue, self-care. It's so interlinked to all kinds of other areas. So it really goes beyond health, and it requires a very strong buy-in from all political sectors to increase self-care.
As a social researcher, I hope there's a day a few years from now when we can start to see the link between, and I know many European countries are now measuring national happiness, right? There's a link between jurisdictions that are putting self-care at the front and center of it, not just as health policy, but as making happy citizens, so that we are more productive and we're more creative and we just are all great. Well, that concludes the latest episode of In Focus with David Coletto. On behalf of my team at Abacus Data, I want to thank the panel and for all of you for tuning in today. For more episodes on this subject or others like it, please subscribe to our YouTube channel, and I hope to see you next time. Take care.